Good day everyone. Welcome back to my channel. I am Dr. Kedar. I am a senior consultant in pediatrics, infectious diseases, allergy and asthma in Ankura hospitals in Kukatpalli, Hyderabad. Today the hot topic of discussion is Metapneumovirus, human Metapneumovirus. So a lot of concerns are coming to me from the patients regarding the human Metapneumovirus. So I would like to just jot down the most important FAQs that the parents are asking me regarding their children and the concerns about this human Metapneumovirus, which is recently out in the media, which is recently has been discussed a lot. So I have grouped these questions, what the parents are commonly asking me, into 7 FAQs, very important ones. So I would just like to review them and give you a short information regarding the same. The first thing is, what is this virus? What is this human Metapneumovirus? So this human Metapneumovirus is a common respiratory virus, just like the flu, respiratory syncytial virus, etc. This is most commonly seen in the winter months and early spring months. So this is a very common virus which we are coming across since a lot of time, since many years. But it has caused more concern because of the increased number of cases that we are encountering right now. Now the second question what many of the parents are putting across to me is, if this virus has been there since quite a while, why are we concerned right now? And does it need hospitalization concerning secondary to its severity and intensity of the disease? It's very much true that the human Metapneumovirus has been around for many years, but it has not been a concern till now. But suddenly, nowadays, it has attracted a lot of attention because of the increased number of cases. So the first and foremost is due to its rapid numbers that are being involved in the general population, it has become more famous. And secondly, the impact on the health. Previously, human Metapneumovirus was seen more in the high risk groups, like those patients who are already having an pre-existing cardiac illness or a respiratory illness, or sometimes because of a lot of other factors like in small children or elderly. But this time it has been affecting a diverse population. It has been affecting all age groups, and that is why it is causing more concern. And very importantly, after post-COVID status, we still are very much concerned about the numbers or the rise in respiratory illnesses. If there is any sudden increase in the respiratory illnesses, we are becoming more concerned, and this is the reason why we are being so panicked after hearing this word Metapneumovirus. Now the next question what the patients are usually putting to me is this infection very fast and rapid in its spread? Definitely yes, it's basically a respiratory infection just like any other flu or COVID. It spreads by respiratory droplets. So naturally the infectivity is there, but the infectivity is far more lesser when compared to other viruses like COVID and flu. Definitely, but this time, since the numbers are more, since the affected population is more, naturally we find it easy to believe that the rapidity of the spread is very much high. And on the other hand, the global impact, since this virus has affected huge population across countries, definitely this has been seen as a major cause of concern. However, it is very important to remember that human Metapneumovirus has been there since quite a while, and it spreads very rapidly in crowded settings. So those in classrooms, in malls, in cinemas, and in crowded places, in crowded settings, the rapidity of the spread of this infection is quite high. Another question what I usually get to hear is, does any vaccination prevent this infection, or does any vaccination like flu or pneumonia vaccination have an impact over the spread of this disease, and are the kids more vulnerable? Because since I'm a pediatrician, I deal more with respiratory illnesses as well as pediatrics. This question is the most common thing that I'm encountering in the past week. So first thing is vaccination. Definitely there is no direct vaccination towards this human Metapneumovirus, but giving a vaccination against pneumonia and flu definitely helps in reducing the intensity and severity of this infection, because ultimately this is a type of flu virus only. So there is no direct vaccination to human Metapneumovirus, but vaccinating the child against pneumonia and flu does have a positive impact. And how do we prevent it? So prevention is basically by following proper hand hygiene techniques, hand washing, preventing contact from sick people, preventing ourselves to going near to the sick people, and wearing a face mask definitely would help a lot. Now, avoiding sick contact is one thing that we should really think about. When we have a cough and cold and a fever, please don't go and mix in crowded places, and do prevent contact from those people who are already having a fever, cold and cough, body pains, etc. The common symptoms that we usually encounter is fever, cold, cough, body pains, earache, eye congestion, etc. And the treatment basically is more supportive, adequate fluids, hydration, and paracetamol for fever. And if any secondary infection is found out, then probably we need to start the child on an antibiotic. Now, another very important question that I usually see is, are there any immunity boosting foods that can be given to the children or to the patients to prevent these infection? Immunity boosting foods as such are not present against this particular viral infection, but a variety of immunity helping foods can be given, like citrus fruits, green leafy vegetables. To some extent, there are certain studies about ginger and garlic also, but scientifically no evidence exists for that. And consuming curd, yogurt, which contains a lot of probiotics. But definitely a lot of research and lot of still more information is needed to brand this as a dangerous thing. But let me tell you, this is not dangerous. Don't hit the panic button. This is a simple viral flu, but definitely in pre-existing conditions, pre-existing comorbid conditions like cardiac illness or respiratory illness, definitely you need to exhibit a little bit of more caution. So the three things: wearing a face mask, hand hygiene, and staying in close proximity in a crowded places to sick people are the three things that will help us to reduce the